Good morning, everyone, and welcome to the 19th Annual Women's Wellness Day. I want to thank Megan for chairing Women's Wellness Day again for a second year in a row. We're virtual, but it's been wonderful to have our Women's Wellness Day committee stay engaged with us during this difficult year and still committed to bringing together all of us for this annual event that many of us wish could be in person. So I'm Shaista Malik. I'm the Executive Director of the Susan Samueli Integrative Health Institute at UCI, and I'd like to give you an update of what we've been up to this last year. So integrative health, I always start with that. What is it? It's really just whole person care that treats the mind, body, and spirit. And in today's talks, you'll see how we address different health conditions, as well as the concept of wellness from all angles. We don't just treat the body, but we also look at the connection with the mind and mental well-being. We look at exercise, nutrition, how the environment and our relationships affect us, as well as basics of how we engage as a community. So the Susan Samueli Integrative Health Institute has taken shape over several years, but in 2017, Susan and Henry Samueli gave us a transformational historic gift of $200 million to UCI to create the Institute, as well as to name our College of Health Sciences, which brings this idea of integrative health through all health disciplines, including the School of Medicine, nursing, pharmacy, and public health. And in synergy with UCI Health, the Samueli College is transforming education, discovery, and patient care to benefit our region, the state, and the nation. The gift allowed the college to now be overseeing integrative health throughout all the disciplines, and the Institute as a mechanism by which to propel the integrative health message across UCI Health. And so one of the most palpable things from this gift has been the creation of a new building on campus. And it's coming very soon in the fall of 2022. So just a short 16 months from now. And this is right at the entrance of UCI on the corner of California and Bison. And it's a 180,000 square foot building that will house the college and the Institute. So at the Institute, our mission is to transform healthcare through the practice of integrative health by conducting rigorous research, providing individualized patient-centered clinical care, and providing services to the community that focus on obtaining optimal health. It's really about not just treating disease, but preventing disease. And also part of our mission is to educate healthcare providers and the community on well-being practices. And Women's Wellness Day is a long-standing tradition and is part of that mission as well. We're aspiring to be nationally known for innovation in integrative health research, education, and healthcare practices. And just a little preview, this is what our clinic's going to look like in the building. This will be the first floor, and the main clinic will be on the second floor. On the first floor, we're going to have an exercise room, a space for meditation, yoga, mindfulness, as well as a state-of-the-art teaching kitchen, and these spaces really will allow us to put into practice and show our patients and the community how do you incorporate some of the principles of integrative health into everyday life? In addition to the clinical space, we'll have access to just a beautiful collaborative learning environment. And in addition to having all the health sciences students rotating through the building in the lecture hall, as well as in our clinic space, we'll also have this new auditorium in which we'll have year-long mini Women's Wellness Day type lectures open to the community. So now a few quick updates on our 4 pillars of Discover, Teach, Heal, and Serve. In this last year, we hired our first Susan and Henry Samueli College Endowed Chair, who's Karen Lindsay, a PhD in nutrition and does work in maternal nutrition and health. We've also launched pilot awards and had 24 proposals submitted, of which we're now trying to select which ones get the award, and just a lot of innovative ideas on propelling integrative health research. We were also awarded a grant during this time from UCI to look at how does biofeedback help the frontline healthcare workers deal with the stress during the pandemic. And then we were awarded a $2.6 million grant on acupuncture and hypertension. And we've been continuing, despite a few weeks of shutdown, continuing on our important research projects, which are funded by the National Institute of Health, as well as the Course Foundation and intramural grants from UCI. One of those intramural grants that we were awarded is from the Brain Initiative, and this is going to be looking at what are the circuits in the brain involved in acupuncture. We'll be using advanced genetic tools to tease that out and really look at the mechanism of something as common as acupuncture and figure out how does treating these acupoints peripherally stimulate different neural pathways in the brain. We're translating that also into a large study of hypertension and including patients on medications to see how acupuncture, in addition to medication, can help optimize patients to have control over their blood pressure. And in the biofeedback study, Dr. Lee is studying how delivering biofeedback remotely and not just in person can affect stress levels in healthcare workers. Now onto the mission of Teach. In the last year, we've continued to enroll medical students in the Heal IM program, which is a track in the School of Medicine dedicated to a focus on integrative medicine. And this track has been very popular with our incoming medical students, with 30% of them applying for a position in this track. In postgraduate medical education, we've continued our family medicine residency track in integrative medicine. And again, 48% of the family medicine residents enroll in this track. Our culinary medicine elective at the medical school has now taught over 151 medical students how to take nutrition education and translate that using the culinary arts into actionable advice for patients. And then in this last year, we launched Integrative Nursing, where we're training inpatient as well as ambulatory nurses, medical assistants, and staff on integrative health principles and giving them tools like aromatherapy acupressure, mindfulness to deploy at the bedside to help patients in the hospital and in our clinics. And I'm going to highlight this initiative because we had very ambitious goals. There are 1,500 nurses in the hospital, and our goal was within this last year to train 85% of them by the end of June. And we have already reached that mark 3 months before our deadline. And this was all accomplished during the COVID surge, with nurses working harder than they've ever worked before, and yet finding the time to complete this coursework in integrative nursing, which was just very, very compelling. And we heard stories from nurses about how the coursework helped them not only help their patients, but help them, with stress and burnout during this time. We are already in a very short order seeing the reach and impact of integrative nursing. So the nurses that I mentioned, 85% of all of our nurses at UCI Health Medical Center have completed this training and now are in turn delivering these integrative health interventions to patients at the bedside. We've already tracked over 1,700 patients who've received integrative health interventions, and we're tracking metrics like improvement in sleep, improvement in anxiety, and improvement in some symptoms like nausea with the delivery of integrative health. We're also looking at some hard outcomes like 30-day readmission, which is the goal of every hospital to make sure they reduce. And we're seeing that we're reducing 30-day readmission by almost 1/2, 11% in those that receive an integrative nursing intervention versus 22% that don't receive an integrative nursing intervention. 54 different hospital services, both medical and surgical, have deployed integrative nursing to patients. And looking at another metric, does using an integrative nursing intervention reduce things like medication use? And indeed it does. The opioid average charge per day was $18 in the group that received an integrative nursing intervention versus $26 a day in those that did not. In our HEAL mission, we also, in partnership with UCI Health, opened a new clinic in last August at the Newport Beach location. And, the draw for that clinic has been bringing integrative health to the Newport Beach community. And it's been very successful in having our clinicians roll out new programs like integrative GI, integrative dermatology, integrative cardiology, integrative pain program, as well as naturopathic services and family medicine services. So it's been really a great example of multidisciplinary team-based care. Meanwhile, during COVID, our inpatient integrative health service continued to be in high demand. And this service delivers acupuncture services to patients in the hospital. And we continue to see demand with over 3,000 treatments given over this last year. And then our fourth mission, which is to serve, we have continued the integrative community clinic program at both the Federally Qualified Health Center in Santa Ana, as well as the Serve the People Clinic in Santa Ana. And this past year, we've been able to expand acupuncture services, which have seen a high demand at the FQHC in Santa Ana. And then we also served our local UCI community with an initiative called the Wellbeing Initiative, where we gave free services virtually for mindfulness, for stress reduction, advice on how to sleep better, and as well as nutritional counseling. And these services were very popular, with serving almost 4,000 visits in this last year. Just a little bit more about the integrative health in the community. At the FQHC in Santa Ana is the Susan Samueli Integrative Health Institute's Lois Eisenberg Teaching Kitchen, which is one-of-a-kind teaching kitchen at an FQHC. And before the pandemic, there were multiple group classes being held there. And although they've been on hold during the pandemic, they will be restarting again soon. The Wellbeing Initiative at UCI has been very successful. We also, in addition to the services I mentioned earlier, we were able to deliver our mindfulness course online and free to our faculty and staff. And now we're partnering with the Office of the President in Oakland to do a pilot in how to perhaps do this across the UC system for faculty and staff. We couldn't do all this without the generous support of our community and our board. Our community includes the Wellbeing Circle members and our advisory board, Sheila Peterson, who's been our longstanding chair, Jennifer Friend, Sandy Jackson, Laura Horry, Linda Musalam, Sherry Phelan, who's our incoming chair this year, Susan Samueli, our founder, and Greg Trojan. For those of you who might be a healthcare provider or student, we do have a CME course starting next Friday and Saturday, May 14th and May 15th, on the essentials of integrative care, where we'll have leading experts from throughout the country giving talks on cardiometabolic conditions, as well as evidence-based approaches for managing chronic pain, and then looking at the benefits of acupuncture for the treatment of pain. Thank you very much for attending the virtual Women's Wellness Day. I hope for those of you who've come in, pass the word along to others in the community that we've been open. We're continuing to move forward in our mission of innovating around integrative health. And again, we appreciate your support during this past year and hope to see you in person next year.